everyone, and welcome to another episode of Fridays with Fawn. I'm Fawn Lopez, publisher emeritus of Modern Healthcare. Very excited to have Gina Calder as my guest today. Gina is president, St. Charles County, BJC HealthCare. I first met Gina when we both were on a panel discussion at the ACHE Congress several years ago. She's an extraordinary leader who is deeply committed to developing diverse leaders and advancing D&I in healthcare. Gina, it's such a pleasure to have you join us today. Thank you.
Thank you for having me, Fawn. I'm very excited to be here and just looking forward to the discussion today.
Awesome. Great. All right. My first question to you is this. You first joined BJC as the system's first Black female hospital president, and I know how important it is to you to help diverse leaders prepare for similar leadership roles. How do we continue to develop the next generation to achieve greater diversity and equity in healthcare leadership ranks?
Yeah, that is a wonderful question, Fawn. And as I think about my own journey and my own experience, what I realize more and more now is that this has to be a commitment that we all sign up to be a part of moving forward and making progress in. It's wonderful to have leaders of diverse backgrounds who are committed to this. But the reality is we're still small in number. Right? When we look at our makeup of various C-suites across the healthcare industry, we're less than 10% people of color in those types of roles. So if we're the only ones who are doing the work, we won't really see the needle move as quickly and as far as we need it to. So very important that we have allyship from other majority members of our leadership community to engage in this important work, and that we're thinking about how we show up. Yes, mentoring is critically important, but sponsorship is even more important. And so, when we're in rooms making decisions about the future of our organization and the talent that we'll need to move us towards that future, it's really important that we're being thoughtful about diverse talent in our organizations and even in other organizations to be able to pull in and give those opportunities for advancement to not only further their careers, but quite honestly, the industry as well.
What does it mean to you to be an inclusive leader, and how do you model inclusive leadership in your own career?
Absolutely. Great question, Fawn. For me, inclusive leadership is mission critical. I don't know about those who might be viewing the session that we're on today, but at least for me, in my experience, this is one of the most challenging times that we've experienced in healthcare to date. And it's not getting any easier, right? We're being presented with all kinds of issues that we're needing to solve for in different ways. And it seems that we have to move faster and be more agile and be more innovative. And the only way that I know how to do that is through inclusive leadership, right? Being able to engage people of all different perspectives and backgrounds, experiences, expertise to be at the table, right? Helping us to navigate, helping us to solve, helping us to seize opportunities. And then, be able to, as we develop a plan and a course of action, engage, right? And be fully bought in to whatever the direction is that we're taking so that we can move forward and be successful. So I found that it's really important that I am constantly asking the question, who is at this table, who is not at this table, and how do we make sure that we're filling in gaps in terms of the appropriate stakeholders.
Diversity, equity, and inclusion are important not only for healthcare leadership, but for the patients and communities that we serve. Can you tell me about your efforts at BJC to eliminate disparities in access and quality of care for your patients?
Absolutely. So Fawn, for me, this is really my due north. This was kind of the purpose for which I entered this space and this industry. And when I got the opportunity to move to St. Louis and be part of this phenomenal team at BJC, I was absolutely amazed at how committed we are at BJC to driving health equity in our communities. And so in my role as president, part of that work involves being able to understand our data and look at, very transparently, what are the outcomes of our patients when we stratify them by different diversity dimensions. And if we're seeing differences in outcomes, then we need to be able to track that back into our processes of care to make sure that we are carrying that work out more equitably, that we are not allowing bias to change how we're providing care, change how we're communicating, potentially, change some of our conclusions about what needs to happen in terms of care or care transitions, so that, our entire community, regardless of where they come from, what they look like, what they believe, what language they speak, right, have access to extraordinary care. That is the commitment that I make every day, and that I support my team to make every single day, and then, hold us accountable to ensuring that that's absolutely what we're doing. And the community is depending on us to be able to do that, but more importantly, they deserve us to do that each and every day. And we're not perfect. I know no organization is, but it at least starts with, right, that commitment, that willingness to articulate, this is our goal, this is our aspiration, and then here's how we're organizing ourselves and our work to be able to move that forward. I recently also had the opportunity to work with colleagues across the country to develop a tool that we have named the bias timeout. And so very similar to a timeout that you would take, before conducting a clinical procedure, we are calling for our healthcare colleagues to pause before we make decisions, pause before we interact with patients or other team members, pause before we move forward in a job interview process or developing or updating a policy, right? And actually identify the potential points of bias in whatever process or whatever policy or whatever decision that we're getting ready to embark on, and then mitigate that bias before moving forward, and then be able to go back, reflect and debrief on, whether that action actually did mitigate it, and then, what might next steps be. Is this something that we need to hardwire and make it a more kind of systematic approach? Or is it, something that we want to continue to work on as individuals, right? And mitigating our own unconscious biases. So very, very excited that, at BJC, we've actually incorporated that tool into our unconscious bias training. And then I am using that with my team, my executive team, in our meetings, to just be able to help us to take that important pause.
In addition to your role at BJC, you are actively involved as a member of many boards and community organizations. Why is board service so important to you, and how has it impacted you personally and professionally?
Yeah, absolutely, Fawn. One of the things that I learned early in my career is that I often would get more opportunity for leadership experience and exposure in a volunteer capacity than I might, right, in an employed capacity. And so I often, as I'm mentoring young people as they're, coming up on their own career journeys, encouraging them, please seek out volunteer experiences. Those count. They still build skills. They still allow you to build relationships, and they allow you to have impact in a really positive way. So those are the reasons why I continue to engage in board service. I always am learning something new. It gives me an opportunity to lend my own skills and strengths and leadership to an organization or a cause that is really important to me and I believe impactful to our community. And also often leads to relationships and partnerships that help to further the mission of my hospitals or any other organizations that I'm connected to. So it has been just very fruitful and beneficial for me to continue to do that work. So right now in the St. Louis community, I actually have a couple of board meetings this week for some of the organizations that I serve on. But, education is huge for me. That absolutely made the difference for myself and my siblings when I look at just the vast amount of opportunities that we had access to that our parents did not. It was about education, right? And,
Yeah.
and the sacrifices that our parents made to ensure that we got a great education in this country. So I always want to give back and make sure that I'm serving in organizations with an educational mission, so that we're creating access to educational opportunities for people throughout the community. And then, of course, I'm very active in my church. Very much a woman of faith. That has been a major part of just my life, not only my career, and so serve on a number of faith-based organizations as well as in my church. Again, really just wanting to make sure that I'm having an impact, broad impact on the community that I serve, but also that I'm learning and I'm growing and I'm developing, so that I can be, just more effective as a person, as well as a leader.
Well, it's a two-way street, right? Everything is a two-way street. And so I've often just amazed at how busy of a schedule you have. You're involved in so many things. And so, which is, it's amazing. And thank you for your level of your engagement and community service. For those that are out there listening, probably wondering how do they get on a board, especially for young professionals. What kind of advice do you give young professionals as to how do they begin to get on a board?
Yeah, absolutely. So I always encourage people to, start with your network. Very important, because we all know someone who knows someone who knows someone, right? So definitely start with your network. If you're interested in board service, identifying, who may be able to help you find those opportunities. The other opportunity often is just through volunteerism. That usually can create a pathway in many organizations, especially nonprofit organizations, towards board membership. Usually there's committees and different initiatives that various organizations are launching, and they always need a helping
Yeah.
hand to get those things off the ground. So if you are willing to volunteer and you're consistent, you're reliable, people absolutely will tap you, right? They'll leverage you if you're willing to have that happen, and just offer yourself, right? As you see gaps, as you're supporting this organization, offer yourself to fill those gaps. Again, usually in these situations, there's much more of a willingness and more flexibility to allow people to, explore and experiment. So you don't always have to have all the credentials already. You don't always have to have, right, all the experience under your belt already. Just having that passion and that commitment, and being, reliable volunteer will often get you there. Some not-for-profit organizations have like advisory committees or young professionals committees that also serve as a developmental pathway towards board membership as well. So I encourage you, look out for those, and raise your hand to become a part of those where that is possible. And be vocal, right? Make sure that people know that this is something that you're interested in, and that you are committed to following whatever the pathway may be to get there. It's important that people know what your aspirations and your desires are. Usually, they're willing to help you.
So, Gina, I know, you are a big proponent of mentorship and sponsorship. What are some steps that you have found helpful in building a mentor-mentee relationship?
Yeah, I think this is an important conversation, and just concept for people to really wrap their minds around. Um, Mentorship is critical. As I kind of came up through really grade school, I started to realize, my parents are amazing, have always been in my corner, great cheerleaders, but they had not been to the places that I was aspiring to go. and learned pretty young that if I was going to be able to be savvy and navigate some of these spaces, I needed to connect with people who had been there, or who were there. And so when you're thinking about mentorship, and you're seeking kind of that wisdom and that guidance and that experience from someone else, number one, I think is important for you as a mentee to be really clear with yourself on what is it that you're looking for, because you do need to articulate that with the mentor that you approach about mentoring you, right? What does this relationship look like? What am I hoping to gain from it? What can you expect from me? What would I like to be able to expect from you? It's almost like a pact, an agreement, right, that you're entering into between the mentor and the mentee. And you want to make sure that for the mentor, that they are benefiting as well, right? This should be a mutually beneficial relationship. That's, I think, when it works best. That there's clarity and there's consensus on what is it that we want to accomplish together in this relationship. How is this going to look, and what's the accountability, right, that we're going to share to make sure that we're getting what we need to get out of it. So I have many many mentors that I've been blessed to be able to connect with throughout my career and just my life journey, and having that clarity, and being consistent in whatever it is that we agree to has been important. I think most important, at least in my experience, has been that if I'm saying to a mentor that I'm going to be seeking you for advice and guidance, my demonstration that I'm actually integrating that advice and guidance, and being able to close the loop and make sure that I'm communicating. Not only did I do it, here's what happened, right? As a result, I just find that really is fulfilling for the mentor, right? That they see that they are actually helping you. So I think that is critically important. And being okay if someone says, oh, I don't have the time to do this now. That's okay. Don't get discouraged. There will be someone else, right, who does have the time. And so, just constantly and being willing to constantly pursue that mentor-mentee relationship, and also recognize that sometimes they ebb and flow. Sometimes there's a season for those relationships as well. And all of that is fine and kind of par for the course.
That's great advice, because as a mentor, you really do want to know if you're really helping your mentee, and knowing that they're taking your advice or suggestion, and either good or bad the outcome might be. It's good to know. It's good to know so that you can pivot, so that you can help them even more moving forward. So thank you for that, for the feedback. So let's talk about support. How can women support other women in their organizations?
Yeah, I would say sky is the limit. For first, clearly, right, you have to have that heart's passion and commitment to want to be a supporter. So you may need to do some self-reflection to just understand where you are in that space. And I understand that sometimes, depending on where you might be in your career, or how long you've been in an organization, or there could be other kind of pressing factors that make it difficult for you to feel like you can be in a position and in a space to be that support. So I think it is important to just take that time to do that inward look and figure out where you are, and then go from there. But I think it's just critically important to create that community, so that women in leadership, because we know still, right, we're watching the McKinsey Women in the Workplace report every year or every other year, and it's like the data either stays the same or gets worse, and especially in healthcare, where we're starting from a 70 to 75% female-driven industry, and then you start getting into leadership and just start seeing those numbers drop off. We need that community of support, supporting one another. Again, allies are important, but we also, right, need to extend that support, being there, being that encouragement, helping people to navigate through issues, amplifying voices very important. Amplifying ideas, being willing to create space, because I often find that our organizations, again, as we get into kind of the leadership levels, they're not always set up and designed for women or for people of color to be successful. And so sometimes you kind of get in these spaces and feel like you're being squeezed out. And sometimes it's unintentional, sometimes it's intentional. So when you're there and you're recognizing that that's happening, we all have that opportunity to be an advocate for one another, right?
Yep.
And to amplify those ideas, amplify the voices that are being represented and shared or not around those tables. And just making sure that people know that they have an outlet, that they have a safe space to be able to come vent or complain, cry, scream, whatever may be needed, to just kind of keep your balance and keep your peace of mind and allow you to keep going. I was actually literally just this morning talking with my executive assistant about being able to just create a space for some of our Black women executives here at BJC. There's a handful of us. So at least just starting with like an informal dinner. We have a number of folks who joined during the pandemic, haven't really had a chance to meet people yet and make connection. So just something informal to just say, we're here for each other, and just to be able to create a space to say, we're bringing value, we're contributing something meaningful to this organization. How do we just support each other to continue to be successful?
That's wonderful. So you've done a lot, and amazing. Your career is just amazing, and I'm just always so, inspired whenever I talk with you about all the work, all the things that you're doing. Who has inspired you to be the leader that you are today, and why?
So definitely my mom. So my mom is the oldest child of 14. I am the oldest of 4. And I can remember very early on her just instilling in me a sense of responsibility, and a sense of just excitement about being the oldest child and what that could mean in terms of being an example and being a role model. And having your siblings, right, be able to look up to you and pattern after you. So she really was the first person, and I didn't necessarily have the leader language, but definitely had an example and some expectations early on of those leadership traits. And then, especially my siblings, I think many times challenged my interest in being a leader and my ability to do so. So I appreciate them for those early challenges, because they definitely helped me to develop, I think, some key skills and strategies around inclusion, around, being able to understand, that each of my team members might have very different motivations and interests and aspirations. And, how do I kind of navigate through all that and get all these people on one page to please have the house clean before my mom gets home. So, grateful to my family for their influence on me wanting to be a leader and getting some early practice at being able to do that. So.
Well, we both are very lucky to have strong moms and great families to support us, right? So
Absolutely.
I am too very grateful for mine. So by now, I'm sure our audience is probably asking themselves, how does she do it? How does she do all of this? So my last question to you, as we're coming up to the end of our conversation, is how do you balance career, personal life, and your passion? And which there's a question that I get asked all the time: is there such thing as balance?
So I actually remember, Fawn, in graduate school, a very, very, very treasured mentor and professor of mine said to me, balance does not exist. You cannot have it all. Pursue your career first, get to a certain point, and then exit stage left so you can have a family and kind of leave all of your career professional aspirations by the wayside. And I was like, oh my God, that sounds horrible. Like that can't be true. But interestingly, I heard kind of variations of that from many, especially female mentors who were, I think, very challenged to lead in organizations and kind of in contexts that maybe weren't as understanding of the importance of balance, and definitely weren't supporting, right? Balance in the lives of everyone, not just women, but everyone in their organizations. I think that things have drastically changed. I think the pandemic, honestly, has accelerated a lot of that change. And there's a recognition now that organizations, employers have to be partners in helping their employees create whatever balance they want to create, right? That balance literally will look different individual by individual, and that the expectation is that, right, as an employer, you are supporting and helping folks to create that for themselves, so that they can, right, contribute fully in your organization and in a meaningful way. So for me, it has been definitely a journey, trying to kind of design what balance looks like for me. I tend to have a lot of energy already, so sometimes that works for me. Sometimes, I find myself maybe kind of taking on a little bit too much, because I know I can kind of manage through it. But for me, my career is part of my purpose. It is definitely a passion point for me, so I can draw a lot of energy and pour out a lot of energy in that space and in that work, and not necessarily feel strained or stretched or burnt out. So I'm grateful for that, for sure. And just my family and friends and my church family have just been a huge part of supporting any and everything that I want to do to have impact. So that has also made a difference. But I've had to learn over time to just give myself grace, to recognize when my body or my mind is saying, look, we need to rest. So if you can just pause right now, that would be really great, and actually listen, right, and do that. And I will also say that it kind of ebbs and flows, right? Things fluctuate. Sometimes balance looks like one thing for you, and other times it looks like something else. And you also have to be willing to kind of adapt and be flexible, and kind of give yourself what you need to do what's most important to you, to be with the people who are most important to you. I often share with my team, because one of the things that we focus on as part of our vision here in St. Charles County is wellness. Our vision is to be values powered, wellness focused, and breakthrough results driven. And when we talk about wellness focused, we talk about the fact that in order to create a space of health, hope, and healing for our community, we have to be whole, right, as members of this team. And so what are the things that we need to do for our own well-being? How do we support the well-being of our team members? And then what are the decisions as a senior leadership team, executive team, that we need to make to constantly foster, right, that wholeness, that well-being, and that wellness. And so that going back to being an oldest child often forces me to say, okay, well then I got to role model this. Like I got to be the example, right? I have to take a day off and actually be off. I can't be responding to emails and text messages. I can't be, joining the Teams meeting on my day off, right? So I'm recognizing more that, if I set the right example, right, then the rest of my organization will see that example and feel supported to follow in that example. So that has been important. But it's not an easy journey, and I give myself grace. I encourage others to give yourself grace. You won't always get it perfectly right, and that's okay. But as long as you are, really focused on understanding what your balance is, and doing what you need to do to achieve that on a day-to-day basis, then you'll be in the right space.
Great answer. Great advice. Gina, thank you so much for sharing your story with us and inspiring me and so many others. Thank you for your leadership and for your commitment and passion for advancing DE&I in healthcare.
Thank you, Fawn, for having me. And thank you, everyone who's stayed with us this entire time. Appreciate you too.
I'm really, really excited to continue on this conversation at the Women Leaders in Healthcare Conference, which is coming up in Chicago on August 9th and to 11th. And to our audience, thank you for joining us today. I look forward to seeing you on the next Fridays with Fawn, and hopefully at the Women Leaders in Healthcare Conference in August in Chicago. Until then, please be safe and be happy. Thank you.